So once you have your strips cut, I want you to round all of the edges on your tape. Rounding the edges is going to help that tape to stick a little bit longer. It's just not quite as easy to catch an edge and pull it off. So we're just going to give a little rounded edge to all of the strips of tape. Now for Haley, I assessed her abdominal separation before this video, and we noticed that she had some doming, or I'd call it more like it looks more like a bread loaf. Hers was most pronounced like at her belly button and above, which is really typical. So I'm gonna apply 2 X strips at the belly button and above the belly button. Now, oftentimes if I saw doming down low, I might also do another X strip down low. With this tape, again, we're just encouraging closure of the muscles that are going to be separating naturally in pregnancy. Research tells us that taping in conjunction with exercise for the first 8 weeks postpartum is more effective than exercise alone at reducing severity and longevity of diastasis recti. So in other words, we can usually get people together faster if we use tape with exercise. When we go to anchor our tape, we don't want any tension on the tape when we anchor the strip down. So we're gonna go from the bottom to the top. It doesn't matter which side you start on. I'm gonna lay that tape down with no tension. The adhesive is heat activated, so if we give it a little rub, we're just gonna help it to stick a little bit better. Then I want my tape to be at a 50% tension. So I'm gonna pull it to 100, back off about halfway, and then I'm gonna have Haley exhale and Kegel to draw her belly button up and in. Beautiful, you see that belly draw up and in. I'm gonna lay my tape down while she's contracting. You can go ahead and release. Good, and then at the end, no tension on that end where I lay it down. Beautiful. We're gonna do another strip on the other side. When you peel the backing off your tape, it's easiest to just give a little tear side to side so you get a small piece off first, so you're not contending with the whole strip getting stuck to itself. So again, I'm gonna lay down with no tension. And then I'm gonna have Haley do a big contraction on her exhale. And as she's pulling up and in, I'm gonna pull that tape to a 50% stretch and then lay it down with no tension. Good. Now these were pretty big strips, so I'm gonna have to overlap a little bit above. If I taped her again, I would cut shorter strips. So now we're gonna go above the belly button. Same exact concepts. I'm gonna do a little tear on the tape. We're gonna lay it down without any tension, and then we're gonna apply that tension as she's engaging. We do want that tape on the skin, so if we're having to overlap, I'm just gonna make sure that my end does touch her skin. And as she exhales, belly button's gonna pull up and in, amazing contraction. I'm gonna pull that to 50% and anchor that down. Again, these strips turn out a little long, that's okay. No tension at the end. As she tightens, I'm gonna see that belly draw in. We're gonna pull this to 50% and anchor that tape down. And that is kinesio taping for diastasis recti.